Hi everyone, I've decided to go live because I've never done a live before and I think it's quite fun just to take you along on a clinic day with me. I've actually just done a client, I've just done a lip filler treatment. A very beautiful, very natural result using a very soft hyaluronic acid based filler, and we had such a lovely result. When my clients have very nice lip shapes, I really like to use a cannula for the treatment. So I can show you what a cannula is. When it comes to lip filler, quite often it's done with a needle, and a needle means that you get a lot of bruising, you have a lot of entry points, and then you get a lot of swelling. But when my clients have really nice lip shapes and they just want a bit of hydration or volume, I use something called a cannula. I'm going to show you what a cannula is. I've got it right here. Cannula is essentially an instrument. It doesn't have a sharp end. So this is a cannula and it gets placed under the skin, and it means that I'm able to treat the area. Here is some dermal filler. I'm able to place the dermal filler within the skin without getting much bruising or swelling from the area. Essentially, I have one little port, and that's the access point. Hello, everybody who's just joined. I'm just talking about doing lip filler with a cannula, which is just a far easier and nicer way of doing the treatment. So you have one little port, and then you have something like this. It looks very scary, but it's not. It's not even sharp. And this goes into the little port, and you're able to place filler into larger areas just like this without having lots of injection sites. I've just had a really lovely case and I've just finished the treatment, and her lips look amazing, and actually she looks like she hasn't even had treatment done. She just got the hydration, she's got a little bit of volume, and we look great. What I would like to know from you guys is if there is anything that you want to ask me while we're on this live right now. I'll give you a second to marinate. Cannula explanation, thank you. So we all know what a cannula is now. We have any other questions? Any swelling? How painful? Looks scary. Swelling? No. Swelling is actually very minimal. Is it painful? What I usually do before any kind of treatment, you will use a numbing cream. So this is the numbing cream that I use. I also have a slightly stronger one, which I'll use in areas that are particularly uncomfortable. Place the numbing cream on, and once the numbing cream goes on, it stays on for about 10 minutes, and it means that the top layer of skin, actually, to be live in your video, it means that the top level of skin actually really gets a really nice amount of anesthetic, so you don't feel very much. Like I mentioned, you have that tiny port, which means there's just one little hole, and that means that from there the cannula can be placed through it, and it goes into the level of skin that doesn't have much pain receptors, so it's really comfortable. It's just a very nice treatment. In fact, after this, I'm going to post on my story the finished result from the lip filler, so you can see that it looks amazing. She looks like she hasn't got lip filler, she just looks like she has slightly more plumpness to her lips. What she struggled with was the tiny little cracks, it's like a fingerprint on the lip. Hers were really quite deep, and as she's moving into her 40s, it's getting more and more obvious. Like I said, she had a very nice lip shape to begin with, so she wasn't looking for a massive plump pout or anything like that. What she really wanted was just to have a bit more of a hydration. With the lip filler, the question, how long will the results last? Lip filler is a very soft filler. I've shown you already on here. Look how it comes out. It's very soft. It's very squeezable and supple. And that's because the lips move a lot. We want our lips to do all these different types of things when we are talking. We don't want our lips to be flat and hard and look like a rock or like duck lips. The lip filler that's used is quite soft, and that means it doesn't last a huge amount of time. For most people, it's about 6 to 12 months that they will get a result from their lip filler. Now that's in contrast to something like a cheek filler, where it's right on bone, or a chin filler. Those types of fillers are harder and firmer because they're placed in a way that it's mimicking what it's enhancing. And so those ones are a bit firmer, and therefore they last a bit longer. Do we have any more questions? That sounds good, actually. There are many different purposes for lip filler. I think in my practice, If you want to have the big, flat, massive, firm, rock hard look, you're not coming to the right person. For me, my clients want soft, natural enhancement. They want it to look like they haven't had treatment, which is quite a strange thing to say, but they want it to look like they haven't come to see me. They just want to look pretty amazing. That's the style of treatment that I do. Hello, everybody that's joining. Do we have any more questions? This was my first mini quick live, just a quick catch up for everyone that's just joined in. I've been explaining the use of a cannula to do lip fillers to get a very lovely subtle enhancement without much downtime. You get minimal swelling, you get minimal bruising. In fact, the person I saw earlier on, she said that she got no lip filler bruising. Now, I will actually never say that to a patient because it's normal to get a bit of bruising, but with a cannula, it definitely reduces the downtime. And that's going to be my quick live for the day. Thought for jump on. I showed everyone what a cannula looks like. It's not scary, it's not even sharp. I showed everyone what some dermal filler looks like. It's really soft. This is the one I used for lip filler. And I'm actually in the middle of clinic. I'm going to jump off. Do I provide a mentorship program? Currently, no, but definitely something to think about in the future. The treatment for lip filler for me is £350, but it will start off with an assessment, of course, looking at what your lips look like and looking at what it is you're trying to achieve, making sure it's realistic and making sure that you're going to get the best result for your features and for your face. But usually around £350 to begin with. Back again later, we'll see. I've got a patient waiting. Bye!